Good afternoon, 3 o'clock, and we're here for our daily update. I appreciate everyone tuning in. As I say that every day, and I really mean that. I'm going to give you a little information here as far as the current numbers in the state of Georgia. I also have some numbers here from our adjoining counties. We've got 507 confirmed cases. That's up from 420 yesterday. We have 14 deaths now. That's up from 13 yesterday. We have 1 in Whitfield, 8 in Floyd, 3 in Gordon, 56 in Bartow. Still the largest impacted group is the 18 to 59 age group, which is 41%. 60 plus is at 33%. And we are also keeping an eye on their Tennessee and Alabama numbers. Tennessee has 228 confirmed cases. 5 are in Hamilton County, one of those being in Lookout Valley, which is the closest to us in Tennessee. 1 is in Bradley County. Alabama has 124 confirmed cases. 1 is in Jackson County, and they live in Bryan, Alabama. Now that is close to home. 6 are in Madison County. The numbers are rising, and the longer we don't follow the recommended guidelines, the longer this is going to last. So please do your part to help us on this. Not only helping us, you're helping the county, and it's so important to take this serious. On the national level, the president has raised the national response level to a level 1. This means that all federal resources, get this, are being directed to this crisis. And that's just unheard of. It's just unheard of that this has ever really happened. At this time, our county offices, of course, they're not closed. We're still trying to do business as every day today. But I feel that's going to change very soon, Monday possibly. We have drafted a declaration, as some of the other counties have, of a local emergency. We have reasons for this because it is getting closer to our county. We do have 2 that are being tested in the county that we know of. We'll have results back no later than Monday, I think, on those, whether they're positive or not. We have had possibly, we've got a lot of traffic coming in and out of here, and what I'm trying to do is get this outside windows I spoke about yesterday, get that thing in and finished where we're actually going to still be in the building, but you'll be able to take care of your titles, and which that's where the most traffic is at, is in this tag office, and be able to take care of business without coming into this building and meeting anyone or bringing into the building. So that'll be a critical. The 3 o'clock briefing Monday will be critical. We'll actually have an answer for that, but we have drafted this, and in fact it's been drafted a few days, but you try to put this off as long as you can because I don't want to feel like, we're closing you out. We're not closing you out. We're here 24/7 for you. You can call me or any of the commissioners. As I keep saying this, you're going to talk to a human, and we will tell you what's going on and what we know at that time. So let me see. I've got a couple of things here too. I had a call yesterday yesterday evening, and Citizens Bank and Bank of Dade wanted me to read this to you. They've actually, it's great that they're working together on this, but they do have an announcement effective March 23rd of 2020. It says, in accordance with the guidelines set forth by CDC, Citizens Bank and Trust, and Bank of Dade, they will begin temporarily limiting lobby access to customers beginning on Monday, March the 23rd, 2020. Both Citizen Bank and Bank of Dade will remain fully functional, operational, and ready to assist you with your banking needs. However, there will be additional safety measures in place. In keeping with the suggested social distancing mandate, lobby access to both banks at all locations will need to be by appointment only. Please do not hesitate to contact each bank to set up a time to handle business which would require lobby access. All ATMs and drive-up windows will be open to normal hours. Please refer to the bank's website for specific hours of operation. Both Bank of Dade and Citizens Bank offer mobile banking, mobile deposit, and telephone banking. Those services will not be interrupted at all. For more information on these services, please refer to each bank's website. The decision to limit lobby access was not an easy decision for the management team of either bank, but they feel it is their civic duty to limit exposure for customers and employees. We will continue to monitor this situation and follow guidelines set forth by our local authorities and CDC. And both the presidents of both banks have signed off on this in their boards. So please, just be appreciative that they're doing this. I know the first thing that goes through your mind, maybe it is negative, but this is something. We're living in trying times. This is historical right here, something that's never happened. Also, we have I had a letter here just yesterday from Atlanta Gas Light, and they fully agreed to cooperate with anything that we do to cooperate with our emergency plan. Had a few questions that we will answer next week to them, but I'll get Carrie to post this online. She'll also post this memo from the bank. It'll be on our website. Also, our extension agent, Sarah Dyer, she contacted yesterday, and Carrie also will share that. It may already be on there, I don't know, but it's really interesting if you've got questions about our food, the food you're eating, the food you're buying, even food that you buy maybe at an open market, and it's really interesting. So go on our website, and you can go on their website too. I don't have the information, but Carrie can post that as far as that goes. So it's pretty interesting reading in these days of that we're going through. That's pretty much everything I've got. We do have, Carrie did remind me of a new website that we have, and it's actually for anything that you need as far as email. If you want to email us, it is so email us at info@dadecounty-ga.gov, and that's new. So any questions or anything, if you don't want to use that, as I said, my number is 423-667-8999. 24/7. You can call me, and like I said, if I don't have the answer, I guarantee you I'll get it for you. I do answer my phone. So that's pretty much everything I've got today. Tune in tomorrow. I mean, things are changing, like I said, daily, and there may be a lot more here to talk about. But right now, I do have Alex Case, of course. He's our MA director, as every day he talks to you. I also have one of my commissioners, Lamar Lowry. He wants to share some things that's going on at his workplace, and also right now I'll ask Alex to come up, and I just appreciate everyone tuning in and being with us.
Good afternoon, everyone. Again, I'm Alex Case, Director of Dade County Emergency Service. I'm also the mayor here of the city of Trenton. I spoke with a few of the commissioners, city commissioners this morning, and Commissioner Powell over Parks and Recreation was concerned if we should talk about our parks. But some of the things that I think people has encouraged the president and the governor is still people that are feeling well and are out and about. If you are out and about, just like buying groceries, or you want to take social distance yourself, at this time our parks, I think both our parks are open for things to do. People are still walking, enjoying themselves. I've seen folks this morning in my neighborhood out walking, and again, the very safe practice is social distancing. All the commissioners are asking a lot of questions. Another issue we had that come up was some businesses have also requested if we're going to mandate any shutdowns, and that would be a presidential or a state declaration that would cause that. But business owners, we want to really, if you do have a hardship with business owners, on the Dade County website, the Trenton City website at trentonga.gov or dadecounty-ga.gov, we do have a link on there for the SBA loans. The state of Georgia was approved through federal with any business is having a hardship with financials, since they are working mostly on takeout. Some have decided to close, and you have a hardship financially. There's very low interest loans for extended times during this disaster. So again, visit both our websites, and that information is there. If you, also businesses, if you are during this hardship and you've had to lay people off, the Department of Labor for unemployment is waiving a lot of the late fees for that once you get them signed up, or this can take effective immediately. So I think the state and everyone is trying to make every effort. If the hardship is there, if you've had to shut your business down due to this and it's there, please follow up with that. Or again, if you have any questions, info@dadecounty-ga.gov. Also, the Dade County Sheriff's Office has info@dadesheriff.com. The PIO and their group as well we're working in a joint information system through all agencies of government for that as well. That was also set up for the Sheriff Cross and his group. Again, we're still working day to day with emergency services, all the PPE equipment that we are continually using for law enforcement and for emergency services. The folks are taking precautions, we're asking questions, and every day, like Commissioner Romney just stated, these numbers are continually going up and they're getting closer to us every day. The concern is, we're using the PPE. CDC had a lot of things yesterday that was shared with us in another conference call about the exposure. If someone is exposed or has potential to be exposed, the proper PPE that we are using for public safety, folks are using, it's good. People that has it, they feel they would have no consequences of if they treat these folks and get them in. Yesterday, 3 of our major hospitals, CHI Memorial, Erlanger Hospital, Park Ridge Health Center, and the Chattanooga-Hamilton County Health Department, and also the Chattanooga-Hamilton County Medical Society released the following statement. And also of yesterday, Hamilton County had 8 confirmed cases in their county. Again, this is a joint statement by our medical hospitals in our area. That is our trauma center, it's our heart stroke centers. This is where we go for our help and when we need this. And it was a wonderful statement. It was also put on News Channel 9 is where I seen it this morning, and I'd like to read it because it is very important and it makes a lot of explanation of talking about what this is and how it's going to help us. The federal officials have also stressed the importance of the healthcare workers receiving priority and being tested because they are in the front lines of patient care during this pandemic. It is important for the public to know that if a large number of healthcare workers in the community is exposed to the virus, forcing them to leave their jobs, it would be impossible for the hospitals to adequately care for the vulnerable patients who may have life-threatening illnesses. Now, that's the biggest thing that's the concern with us right now, is that if a lot of these folks get sick, what are we gonna do? And that they will be limited to exposure, if not, and to have to wait a while before they can go back to work. Currently, testing supplies are extremely low in the region, and therefore testing is only available to the individuals with specific symptoms and only after ruling out other conditions during a medical screening, as well as individuals within 14 days of symptoms onset had close contact with a suspect or laboratory confirmed COVID-19 patient, or who have traveled from the affected geographical area within 14 days. So unfortunately, we're in early season of allergy season, and seasonal allergy symptoms mimic mild symptoms of the COVID-19. It is important for people to use their usual allergy treatment for mild symptoms. Again, this is with the spring coming and with the pollen falling, these symptoms mimic some items of the allergies that we may have. And that's why we talked about using your over-the-counter sinus medicine or your Mucinex for your congestion, whatever you use for congestion, and just treating yourself over the counter. Treatment for mild symptoms, but to contact their health provider if symptoms progress. If you progress of those symptoms and you have a fever of 100.4 or significant respiratory issues, you need to contact your health provider. Again, don't show up at the doctor's office, don't show up at the ER, contact them if those symptoms are still mild and you mimic that temperature. If you do start fighting a temperature, they're asking that you alternate with your Tylenol and Motrin. You also have to consider the time it takes for the test results to be received from the physician and health departments. Many of these results are returning from outside labs days after the sample has taken, leaving room for people to be infected. If the patient does not follow the proper quarantine steps and they go out and do things, we have the chance of someone else being exposed. So the same recommendations, again, this was from CDC, self-distance, self-quarantine remains the best way to slow this COVID-19 down. Again, we stress the people, the community, of what we're trying to do to take this and slow the curve down. As with tests and other infectious disease such as influenza, the COVID-19 test is not available to the general public on request. Individuals need to be evaluated by their healthcare providers, urgent care centers, or emergency room before the test is ordered. Now, to the point where you feel that you've reached that temperature, you cannot control it, and you have difficulty breathing and chest pains, rest and shortness of breath and can't get it, call 911. Call your physician, and that's when those things would go on once they evaluate you. If you have mild symptoms, you're urged to stay at home and isolate yourself from other family members. Again, so it's what we talked about earlier. If your symptoms worsen and you have the temperature of 100.4 or above and you develop more significant respiratory problems, call your medical professional immediately. If your healthcare provider will screen you by phone using CDC protocols, use specific health conditions. You may also contact flu or strep tests to rule out other illnesses. Each facility has a visitation policy, and visitors are asked to go to their websites for updates on the information, and visitors are asked to go to the websites to update information. All of them are really stuck together in making sure that we're isolating on this. Physicians and hospitals are following the process base of CDC protocols and stewardship availability of swabs and other supplies. Reporting of positive test samples continue to be under review of the state and local health departments, not local hospitals or healthcare facilities. So it's really great that our main facilities, our hospitals are working together and done this joint statement. Again, it's on News Channel 9's website, or they may have it on each one of their websites. But again, we continue to ask you to social distance your small gatherings. And another thing that has come out in some other things is when you're out doing things, and one of the things that come up is pumping gas, grabbing the pump handle, putting it in and using that. Please try to take you some isolation or some gloves, or have you some either garden gloves or anything besides skin contact. And if you do, have your sanitizer to clean your hands right after. Again, all this information is on TrentonGA.gov or DadeCounty-GA.gov. If you have individual questions, contact us at info@DadeCounty-GA.gov. Again, we continue to keep up with this, and we ask that you pray for the county, the community, and our nation. Thank you.
Thank you, Alex. That was a good report. Lamar, you want to come on up and share with us some things that are going on maybe with your life and what you're doing? Come on up. Yeah. Mr. Lamar Lowry.
As many of you may know, I've been in the healthcare field for 35 years now. And although this is something new, we have dealt with deadly diseases and different things for all my time. I know the healthcare industry from the beginning, but right now we're going through a special adjustment, and I work for I work with CHI Memorial of Georgia. I don't actually work for them. I'm over the facilities department. But we're really asking everybody to cooperate with the hospital personnel. You would think that would be common sense right now, but there's a lot of people that have really been harassing and belligerent toward our nurses and our security not understanding what we're trying to do. We're in a battle to save people's lives. Now, at our hospital, if you're a patient in the hospital, you're only allowed to have one visitor, unless it's an end-of-life time. And then you're allowed to have a pastor and one visitor at the patient's request. Now, we also have a nursing home below us, and we have a skilled care unit in our hospital that are allowed no visitors. And I noticed on Facebook we have one of our own in a healthcare facility somewhere. I'm not sure where she was at, and I'm not going to call her name because I didn't get her permission to do that. But she was in a hospital facility somewhere, and she was said on Facebook, she said, "I'm here now and I'm by myself." It's a bad feeling. So if you know somebody in this position, please try to reach out, call them. Every room's got a telephone. You know, I'm a facilitator. I was an electrician by trade, but I've always been taught at the hospital I'm a healthcare worker, because I had to provide the environment for a healing. So I don't give medicines, but I can always take time to help people, have a good conversation with them. I may be doing it with a mask for a while, but we can still do that. Now, I know there's some of the things I want to would like to talk about is the hand washing. I know a lot of people are concerned that you can't hardly find sanitizer right now. But what we've been taught at the hospital is soap and water are as good as hand sanitizer if you do it properly. The proper way to wash your hands is wet your hands first, plumb up through the wrist, apply your soap, and then lots of friction. Make sure you get the back of your hands, your palms, in between your fingers, and especially your fingernails and around your cubicles. Dry off with a towel. And always try not to touch your mouth or eyes or nose, because this can get in through your eyes also. The social distancing is very important, because we know now that the droplets when you speak, if you're infected, and it may be up to 2 weeks before you actually show symptoms. That's why you want to stay back from people. Droplets can contain the virus. People that are sick and coughing, you especially want to stay, I'd say more than 6 feet. I'd say get away from them if there's any way possible. One of the things we do, we check our temperatures. Healthcare workers, we're asked to check our temperatures every night, because we go through the same screening to enter the hospital as visitors do. We're questioned if we got to showing any symptoms at all. So if you know people in the hospitals, they're at a time when they're not going to have a lot of visitors, especially the elderly in senior facilities. So try to reach out and at least talk to them on the phone, an encouraging voice. The last thing I got is, the people that know me know I love to garden. And that's one thing that this may get serious enough for essential services, may be the only thing that you're allowed to do. We're not far from that now, I believe. But I was at the Rising Fawn Hardware this morning, and I'm getting my seeds and stuff, so I'll be ready in the summer in case this gets worse. That'd be one thing that you can do and still enjoy yourself. So I guess I ask the prayers of everybody, and because everybody's important. I've heard people say, well, the healthcare workers are more important, the truckers, the farmers. We're all in this together. Everybody's important. So do what you can, do your part, and I thank you.
Thank you, Lamar. It's a good report. We'll wrap it up for today. Carrie, if you want to come up, you may have a few things here you might want to kind of wind it up, but I do appreciate everyone tuning in. We will be back here tomorrow at 3 o'clock, as we will every day until this thing starts going to a positive. And so just keep in touch with us. During the meantime, as I say this every time, if you've got any questions, call us. We encourage you to call us or email. We do have that email, new email address up, and please do that. And until tomorrow, we'll be back at 3, like I said. And Carrie, if you want to wind it up, that'd be fine.
Yesterday, roughly 2,000 people saw this message within an hour, but not everybody is on Facebook, and some people were asking, so how can I see this if I'm not on Facebook? So we created a YouTube channel, Dade County, Georgia YouTube channel, and we added all of these updates to that YouTube channel. This update will also go onto that YouTube channel as soon as this live broadcast has ended. But here's what you can do to help us spread the word. There's a lot of false information getting out there, so make sure that you tell your friends, your family members, your neighbors to verify their information. Check it out on our YouTube channel, on our Facebook site, our website, all of the links of which are in the comments of this live video. And remember, if you have any questions, day or night, give us a call. You can call us at 706-657-4625. Commissioner Rumley has also given his number several times. It is also in the comments to this. You can call me at 423-290-6655. You can email us at info@dadecounty-ga.gov, or you can send us a message through Facebook Messenger. We will get through to you. And one thing that we feel is very important is that you know that we are here for you in times of uncertainty like this. Just please know that this local county office is here for you. Thank you so much for watching, and we'll see you tomorrow at 3.